Hello and welcome everybody. It's Anna Patrick here at CSG Actuarial. I have a special guest here with me today, Olivia Richardson. She is the Executive Sales Director at Senior Marketing Specialist. Thank you so much for joining us today, Olivia.
Yeah, thank you for having me. I've been really looking forward to doing this for a while, so I really appreciate the opportunity.
Yeah, I love that. Just to give everyone a little bit of background and why we decided to do this webinar here with Olivia is a couple of weeks back, we did a Medicare Advantage sales strategy webinar with Bill Correa at Meschloss and Fleming. And during that webinar, he brought upon this idea that you had, or that you guys have at Senior Marketing Specialist, about these seminar topics and the idea of the 10 things you need to know about Medicare instead of doing that traditional Medicare 101. And as soon as he said that, I got just a ton of messages in my questions and in my chat, like, I need to know these 10 things. I need to know these 10 things. And then we started getting emails from a ton of agents asking, I need to learn more. So I was like, okay, we're going to bring Olivia on. We're going to cover these 10 things in this seminar topic idea. So that's kind of how we got started and kind of got this idea going. So welcome everybody. Many of you may have been on that previous webinar, and that's why you decided to join this webinar here today. So before we get started here, I always like to know about the agents that we have on the training, just to get familiar with you all. That way, Olivia and I can make sure that we cover topics that are going to make sense for you during this presentation, and we just get a better understanding of the agents that we have on today's training. So just a couple of questions before we get started. Our first question for you is, do you currently participate in seminars? So do you host seminars? Do you currently participate in any? Yes or no? Just a simple question about if you are currently doing seminars. You know, this webinar here today is going to cover a seminar topic idea and different things that you can talk about during these seminars. And then we're also going to use the CSG quoting and enrollment platform to really dive into demographics of where you should be hosting these different type of seminars. So we're really going to use both topics or both ideas together. So 60% of you said yes, you currently do. 40% of you are saying no. So hopefully those of you that do participate in seminars, this is going to help you enhance those presentations. And then those of you that do not, hopefully this will give you some encouragement and some advice for you to start that process. All right. Next question here, because we're going to give you some ideas on how to get people to participate. So just curious if you struggle to get people to attend your webinars or to attend your seminars. Just simple yes or no. If, you know, we all spend a lot of time, a lot of energy marketing these events out, making sure that you have all the preparation, papers, handouts, flyers, trinkets. So for people not to attend these can be really difficult. So just kind of, do you currently struggle at all with that? Olivia, just to kind of give you some answers on how agents are answering this question, 70% are saying yes, they are struggling to get people to attend these. 30% are saying no. So hopefully we can give you some help and some guidance there. And then the CSG tool is really great to making sure that you're marketing this in areas that would make most sense for you. So again, we're going to kind of put these two ideas here together. And then the last question, for those of you that are hosting these, what is your average turnout? Less than 25%? Is it anywhere from 25 to 50, 50 to 75, or greater than 75%? So for those of you that are hosting these, what is your average turnout of these events? Our goal during this presentation is to give you some ideas to enhance these and how to market them. That way, most of you are seeing that greater than 75%. So that's really our goal here, is to get you in that level. Olivia, give me a little bit of background as agents finish up answering this question. The agents that you currently have today that are doing these different seminar topics that you're going to talk about today, what are they seeing as far as their turnout and their return on their investment putting these together?
Yeah, that's a really great question, because you want to make sure that these theories that we have applies to what real life looks like. And so we do have a lot of our agents who thrive in the seminar fields, and we'll talk about a little bit more why here in a little bit, but they started incorporating different types of presentations like the 10 things you need to know about Medicare. And they did see a considerable amount of increase in their turnout. We'll talk about why that is here in a little bit, but also the closing. Now, to say, where, can I get some numbers? Can I get some specifics? Are they seeing 10, 20, 30 people? It really does go across the board. And the main reason for that is, yes, the topic of your seminar is really important and has a lot to do with how much of a crowd that you draw. But there's so much more that goes into, making sure that you have, I think, what we would consider a successful seminar. A lot of what, like what you were talking about with CSG, are you marketing it in the right places? Are you in a neighborhood or a facility that it makes sense to do that? Consistency, is this your first seminar or is this your 30th seminar? A lot of those things do have a lot, and we can talk about that, absolutely. But to say agents who are doing your traditional 101 versus agents who are doing some of these more creative topics are immediately seeing much more of a turnaround, or a much better as far as closing and getting more people in the room.
Right, yeah, a lot of agents, about 56% of them said less than 25%. So let's kind of go through this here, and if you want to kind of give a little introduction on yourself too, Olivia, I think that would be helpful for a lot of agents that are not familiar with yourself or senior marketing specialists.
Sure, yeah. So again, my name is Olivia Richardson. I'm an executive sales director here. I've been with Senior Marketing Specialist since 2013 and have had every single job in the sales department here, as far as cold calling agents, trying to convince them to work with us, all the way to, again, being an executive member like I am now. I actually got my start in, when I was in college, I actually got my start with sales by doing door-to-door campaigning. So I did do, again, political, didn't matter if it was left or right. If you hired me, I was your girl. And I worked all the way up to training and education is a huge passion of mine. I actually, if for anybody who's familiar, I co-host a web series called Medicare Cafe that can be found on YouTube, and most of the content on our university is either this face or this voice. I've been doing it for a long time, and a lot of those videos I have bangs. Poor decisions were made, but for the most part have been giving pretty quality advice as far as sales and education goes.
Yeah, I love that. I've seen a lot of that. So you're in a good position here. So let's go ahead. Let's jump into Olivia's presentation here, and then after we are done with that, we'll go ahead and pull up CSG too and see how you can apply CSG. And for those of you that are not familiar with CSG, I'll give you all of the history here after I let Olivia kind of take the stage here. So we're going to go ahead and get started.
Perfect.
I'm going to say, sorry, one thing before. If you have any questions as we're going through this presentation, feel free to type those questions into the questions box. I will go ahead and get them answered. And we are recording this, so we know you are all active selling agents. If your phone rings, somebody comes into your office, you have a meeting, you have to jump up for whatever reason, we are recording this and we'll make it available to you. So with that, take it away.
It's great minds, because I was literally going to say I thrive off interaction. So if there are any, I always say questions, comments, concerns, threats, or promises, let me know. I do best with an audience. So, so yeah, the biggest question, I would love to say that it came from my brainchild to do these style of seminars, and that's not true. Senior Marketing Specialist has been cultivating and building these style of seminars since, probably before I even joined the ranks. And it's because they work. We get a lot of requests when it comes to marketing and things like that. We always talk about what's the best method of building a true client acquisition or lead generation without having to relying on purchasing leads. Seminars are by far my favorite way to do that, because they truly combined both marketing, which is brand recognition, that pull style marketing, becoming that familiar face, being the go-to organization, but it also does prospecting, which is getting butts in seats, signing applications, really what makes an insurance agent money. seminars are the best way to combine those two things. Now, Medicare 101 is by far the most requested piece that we get asked for. We do build, we call them seminars in a box. We do have everything from, Medicare 101 to some of the more creative seminars. And creative seminars, they just get better turnout. Medicare, guys, as much as it pains me to say, knowing that it's our passion, Medicare is not a fun, sexy topic. You know what I mean? Medicare 101 does a great job of drawing in that turning 65 or that new to Medicare market, but it doesn't get everybody because most people don't want to know everything about Medicare. That's what they rely on an agent for. But you're also missing out on people who have been Medicare eligible for some time. If I've been utilizing Medicare, I'm 72, 73 years old, I've been on Medicare for some time, why would I attend a Medicare 101? I've already been getting the content, I know what to expect, that's not gonna interest me. But I'm still a really good prospect for agents. I still, I still have a lot of help and a lot of opportunity in having me as a client. So that's why we see a lot of effectiveness in creative seminars that just throw what I would call a wider net. Now, the top 10 things you need to know about Medicare, that's a popular one. People love those numbers, but we've also seen a lot of success in seminars and things like Medicare and diabetes to target your diabetic clientele and really help you with those special needs plans. You know what I mean? There's also, we see success in how Medicare works when you leave the hospital. Again, these are information that comes across as you being the Medicare expert, but you're appealing to a much broader audience than people who want to learn the ins and outs of Medicare. So that's why these seminars work. That's why we see a higher response to them. It just, again, it's the biggest thing I will say though is you have to have the talent and the ability to set the expectations. Because Medicare 101, it makes sense. The next step is obviously we're going to do an appointment. I'm going to enroll you in a MedSup or Medicare Advantage. So when you do these style of seminars, you have to set the expectation early. I'll talk about that here in a little bit when we talk about the calls to action. So the next slide is going to be talking about what are these 10 things. And I feel like I'm going to disappoint some people because these 10 things you need to know about Medicare, guys, this is child's play to an agent. These are things just like, this isn't worth talking about. It's super simplified. It's super easy. There's nothing groundbreaking here. And that is because, guys, we focus, why this is so effective is that it focuses on knowledge that actually impacts your clients. And I'm good at Medicare. I'm not good at grammar. I don't know if it was supposed to be the effects or the affects, but we're going to leave it there. I do Medicare. I don't do grammar. But this is stuff that it's so easy to understand. And it's because it's not jargon. That's something I always thought was really interesting is that if you've done any research on public speaking, Steve Jobs, who is known and accredited, obviously I don't have to explain who Steve Jobs is, but accredited for being a really intelligent human, his rule of thumb was you never speak above a 4th grade learning level because it goes over people's heads, it doesn't stay with them, they don't pay attention, they zone out really easy. So keeping the knowledge very simple, showing them specifically how your Medicare affects you will make a longer and lasting impression and will make it to where it does open the door for cross-selling opportunities, which is why, again, I love them. But I know when everybody's asking, like, we need to know these 10 things. Guys, you know the 10 things. These are the 10 things that I recommend. But even when I was creating this, I was still plugging in, oh, actually, this makes more sense to talk about with this group. This makes sense. So it doesn't have to be the same 10 things every time. Now, before we get into what those 10 things are, last thing I will say about when you're setting up your seminar, try to keep it to less than 20 minutes. And I know people are like, I'm going through all this work, all these marketings. Like, no, if I'm going to have a captive audience, I'm going to have a captive audience. Right. Again, we're not wanting to compete with Star Wars, guys. Like, again, Medicare, though we love it, it's not a fun, exciting conversation. It's the same reason why you'll see an average TED Talk is about 18 minutes. It's because humans have this really short attention span, so you have to re-engage somebody every 18 minutes. So if you are the sole speaker, if you're not partnering up with another professional to do these seminars, your target time needs to be between 20 to 30 minutes to really be impactful, to really make people feel like it was worth their time and valuable enough to continue to work with you.
Right. And also, it's not going to take up their whole evening or their whole day. Maybe they have somebody that's going to drop them off and go run errands while they're there. Just, again, this is only 20 minutes that I have to attend this. It's not a whole day. It's not a driver's ed course where you're just sitting there all day listening. So I really like that, is making it to the point and making it worth their time too.
Well, and we think of it like this: if a client goes through this and it's an hour long, even an hour, they're never going to go through it again. So they're not going to come to another one of your seminars, and even worse, they're not going to bring their friends and family, because nobody wants to put them through that as well. It may be super informative and super, helpful, but it's all about that experience. And so if they have a negative experience, then they're not going to re-engage in that, or invite their friends to engage in that.
Right.
So like I said, guys, I don't want to disappoint. These are the 10 things. It's so easy. It's so you're just looking like, guys, this is a duh statement. Well, yeah, for insurance agents, people, if you've worked in this industry for more than a year, these are pretty duh things, but they're very impactful. These are the 10 things that will affect your clients and your prospects' lives. So I can go through these really quickly. I'm just kind of talking about what we recommend per one. Again, Senior Marketing Specialist already has this presentation made. I will say, if you have an active contract with us, you can go to our website. You have access to it. Some of our seminars have been pulled and will be re-added. We're doing all the compliance updates like everybody else is. This is considered an educational seminar because it doesn't talk about C or D benefits at length whatsoever. So it does not need to be registered, does not need to be approved, things like that. But we still want to make sure we're doing our due diligence for compliance reasons. But flu. What we want to talk about with flu shots is that you get an annual flu shot, should be 100% covered. Same thing with COVID-19. Want to make sure those immunizations are 100% covered. If you ever, and this is what I would tell in a presentation, if you ever receive a bill, your next phone call needs to be me. If you ever receive a bill for any of these immunizations, I am your next phone call. Now, the only exception to that is going to be the shingles vaccine, which is a huge question that we get, which is covered under Part D. So making sure people understand and set the expectations, but also coaching about how you are a value add to have versus them working directly with the carriers. Right. The next one is the enrollment and life changes. A lot of people don't understand that moving into a new area, or getting a divorce, or income changes, things like that. A lot of people don't realize that life changes can also result in enrollment opportunities. So teaching them to, like, here's how you can recognize if you're not happy with your plan. Here's some ideas on how to recognize how we can change or help you through that enrollment process. And just educating again really quickly about what a life change looks like to CMS. In the place of the enrollments and life changes, I've seen a lot of people talk about cardiovascular screening. And a lot of people do that during like Women's Health Month. They'll go talk about cardiovascular screening and other things like that. So these are pretty interchangeable, but that's one that I see gets a lot of traction. Inpatient versus observation. People have no idea that these terms exist. Most importantly, talking about how maintenance medication is not covered under observation care, and educating them that if you are not admitted into the hospital, but you're still hanging out at the hospital, send someone home, have them grab your medicine, because those are not going to be covered while you're in observation. Also talking about questions to ask to define, are you inpatient or are you observation? Again, these are things that really impact a client and their experience with Medicare. Travel benefits. We talk a lot about travel. Medicare stops outside of the borders. Or we're talking about if you're on a Medicare Advantage plan, what does a passport program look like? National networks or emergency rooms. We know that emergency rooms will continue to be covered even if it's out of network, if it's an emergency situation. So educating your clients on what does travel look like? When should they invest in travel insurance versus does a MedSup or a Medicare Advantage plan work for them? A lot can be covered in that travel benefit.
Mm-hmm. Would this also incorporate people who have like a second home somewhere else? Maybe they go, to Florida or Texas or Arizona during the winter, kind of talking about how that second home could come into play too, because a lot of individuals have that too.
So I am close to the Lake of the Ozarks. If you guys are familiar, it's kind of like the show Ozarks with Jason Bateman, but I'm on the vacation side, the party side. And I was working with an agent that they do seminars partnered up with real estate agents. The real estate agent would say, what does it look like to own a home at the Lake of the Ozarks? What are the opportunities here? What does it look like to be a home buyer at the Lake of the Ozarks? And the agent would come in and talk about what Medicare options are available here, because most of the people moving there were retirement age, which is the amazing part about doing these seminars, is that it can be whatever you want. You can base, there was another agent that I worked with that did a seminars tied with a personal trainer. The personal trainer went into, what I can do for you as your personal trainer for mobility issues, how to stay young. And they did the top 10 things you need to know about Medicare, focusing on preventative services, focusing on how to stay healthy. So you can cater this to whatever networking partner you want to be with, but yes, absolutely, travel can be associated with that.
Yeah, I like that.
The Part B deductible, again, something that your consumers are going to have to deal with if they're on a Plan G. And this has become really popular, talking about those Part B rebate plans or the Part B give back money, talking about like, what does that actually mean and what does that look like? Again, focusing on things that will affect your clients. VA coverage, the biggest topic there is talking about Part B coverage versus Part D coverage. Very confusing. Part B, it is not credible for B, it is for D. What does that look like? And what does it look like if you wanted to add optional benefits with your Medicare Advantage plan? Things like that. Preventative screenings, we have a list of like 15 annual preventative screenings that a person is welcome to. Some of them are things like I've never even heard of. Some of them are really interesting about like social, like mental health, things like that. Drug savings, we talk about two things. One, we talk about three. We talk about making sure you're on the right drug plan. We talk about a program called Needy Meds. Needy Meds is an organization that we all know that pharmaceutical companies, there was legislation passed that all pharmaceutical companies have to offer either coupons or savings programs based on their medication. However, they don't have to make them easy to find. You have to go through like the deep bowels of their website to find some of these programs. And so what Needy Meds does, it combines and puts every single pharmaceutical program into one website. So you either search by condition or you search by medication, and it pulls up every single program that is available for that consumer, which is a really cool program. Again, that's needymeds.org. So we talk about Needy Meds and how to use that. The last one we talk about is Clever RX, which is essentially like Good RX, except Good RX is a direct-to-consumer product that was recently purchased by a lead generation organization, which is kind of sketch. Clever RX is a drug saving coupon as well that you can use through your phone, and the agent gets paid commissions every single time somebody fills prescription with it. So those are our drug saving ideas.
Yep, I just sent in the chat, the needymeds.org. I sent everybody in the chat that link if you want to go out there and visit that. What was the other website, just so I can send it to everyone in the chat?
So the other website is actually something that you have to work through an organization like Senior Marketing Specialist. It's called Clever RX. So you can reach out to us, but again, it works just like Good RX. It's a phone, a card, it's a coupon. It cannot be used with their drug plan, but I do really like them because if some medications are going to be cheaper using Clever RX than it is their drug plan, and you keep people out of the donut hole. You're not using their insurance, so they're going to take a lot longer to get into that donut hole. But every single time a person fills their prescriptions, the agent receives a commission. So call our office, we'll get you set up with it.
Awesome. Whoops, I went too fast there.
Oh, you're good. These next ones are pretty self-explanatory, guys. Ears, eyes, and teeth. It's insane how many beneficiaries have no idea that Medicare doesn't cover dental, vision, and hearing. And what I like to do is when we go over these parts is say, when will they? So talking about the only single time that Medicare CMS is going to cover your teeth is if you have a life fearing, what am I trying to say? A situation to where like you have an infected tooth that's going to affect your brain. Medicare will pay to remove it, but that's it. As far as cavities and everything else go, unless it's considered medically necessary, really defining what is medically necessary. Obviously, that does open up the opportunities to discuss, cross-selling or benefits to these plans. And again, a lot of people are comfortable with that topic because they're familiar with dental insurance. They're familiar with that through their employer.
Right.
And then last but not least, we talk about cancer costs. Again, another one where I just see eyes widen because, people who are like on a Medicare supplement, JAMA, which is the Journal of Associated Medicine of America, it's JAMA. They reported in 2016 that even somebody on a Medicare supplement plan F still expected to pay about $6,000 out of pocket when diagnosed with cancer, and it being the number one reason for medical bankruptcy in the United States. And so we would really like to educate on what cancer, where that cost does come from, even when not medical, really educating people on why cancer is so expensive. And so those are the 10 things. This is not rocket science. I'm sure a lot of people just have like, really? That's it? But that's the brilliance of it, is that it's so simple. People really enjoy the information and they retain it because of its simplicity.
Yeah. So for those of you agents, utilize the questions box here, but I just want to get a feel for some of the agents that have done these seminars. Do you ever touch upon any of these 10 things? Feel free just to type them into the questions box, just so we can kind of get an idea of, are you currently utilizing any of these 10 items? Are you surprised by them? And a lot of these things here that we show you on the screen, these are all things that can also be used in conjunction with the CSG quoting tool. So you can see some of these benefits when you're running quotes within CSG to know what's covered under these different items. Even that cancer cost, keep in mind that with some of the hospital indemnity plans that you may be cross-selling with a Medicare Advantage plan, some of those have cancer riders. And you can see some of that availability within the CSG when you use the hospital indemnity quoting. Let me just go through just so we can make this, a couple of people are saying yes, covered some of them, covered dental, but not the rest. Yes, they definitely cover patient versus observation. Maybe some people are saying I've used 4 out of the 10 of them. But so some of them are using these different topics, but a lot of them, these are newer. How do you keep all of this within 20 minutes is one question that I just got in.
It's honestly, there's going to be some things, it's all about budgeting that time. There's going to be some things that you do want to spend a little extra time on. Drug savings is something, cancer costs, I want to spend a little extra time on. A lot of these other things are simply, they don't need the explanation. Consumers are not looking for why things are covered or how they're covered. They just want to know that it's covered. So some of them are just the things like, hey, just keep this in mind, know that this is happening. Well, it allows you some time to go in a little more in depth on some things that are less self-explanatory. I'd also say for a lot of those people who are saying, oh, I always, I want to make sure I talk about travel. I always talk about dental, vision, hearing, and mind. There's a lot to be said about packaging. There's nothing here, I think I've said it 50 times now, and it's true. Nothing here is new. But there's something about the package that something comes in to make it seem new or to make it seem exciting. And so when you can say, a title that says 10 things you need to know about Medicare, it got everybody's attention here because it's a very attention grabbing, very pretty package that comes in. So making sure you pay really closely to what, to making sure that you're setting the right expectations for what that looks like.
Well, yeah, let's keep going. I think we have some more questions that are coming in that I think you're going to start to cover here. So let's go ahead and continue on.
So this is something that, again, for me, doing seminars being my favorite thing ever. I love being in the center of attention, so I thrive for it. But the funny thing about doing seminars is, yes, it's great at promoting your name. Yes, it's great about promoting your brand. But if you're not actually taking applications and gaining new clients from your seminar, you're losing money. It's very costly. I know, Anna talked about it earlier about how are you renting space? How are you inviting people? These can be really costly events if you allow it. So the only way to really turn this marketing event into a true prospecting event, aka getting new consumers, is making sure you have a really strong call to action. Unfortunately, when I talk to agents who do a great job of getting people there and have great topics, but they don't have any sales, it's because their idea of follow-up is saying, I'm going to collect everybody's information And then after the fact, I'm going to give them a call and try to set an appointment after the fact. Well, what happens is that if you're not striking while the iron is hot, if you're not taking advantage of that audience, they're moving on to the next thing. So when you do call them days, weeks down the road, even hours, they've moved on to the next thing. You're now a nuisance. Now you're the salesperson being pushy. You're the timeshare guy following up with them. So what you do is you need to let them know in that moment while they're engaged with you. Let them know what the next step is, and then create urgency behind that step. So they need to act now. So this is what I tell my agents to do at any seminar. I don't care what's it about. At every single seminar, I advise them to have like one of those like desk calendars, those giant calendars. Have that at the back of the room and have preset appointments. So if you're expecting 30 people there, have 20 appointments set. If you're expecting 5 people there, have 2. And what you say at the end of your presentation, doesn't matter what it's on, is something along the lines of, hey guys, thank you so much for hanging out with me this afternoon for the last 30 minutes. I do want to clarify that Medicare is such a personal conversation. What you should expect from your Medicare may look different from your neighbor or even your spouse. So if you want to have a one-on-one conversation about what you should be getting from your Medicare, I have appointments set up specifically for this group today. Go to the back of the room, go ahead and sign up for one of those appointments. Now, if one of those time slots don't fit for you, because I understand retired people are the busiest people I talk to. So if one of those time slots don't fit for you or those times fill up, then come see me at the end, come see me, and I will make sure we get a personalized appointment set up for you because this conversation is that important. You will have people who walk out of the room. You will have people that say, no, I got what I needed. I'm going to move on. I'm really hungry. I want that Auntie Anne's pretzel. But people understand if I want to work with you as an agent, these are my next steps. And I'm comfortable to do that because you just gave me so much valuable information. I want to work with you. So if that is my call to action, strike where the iron is hot, get them to act while you are still engaged with them.
Great.
And that's it. Easy enough.
That's awesome. No, a lot of agents are asking, how do I get going? I know you mentioned that you guys provide these seminars. So if you want to talk a little bit about what you guys offer to agents.
Yeah, so we call them seminars in a box. And we, like I mentioned, we do have the Medicare 101, but we also have this presentation. We have Medicare and diabetes, things like that. In order for you to receive access with it, we're FMO, but you have to have at least one contract with us. So as long as you have one contract with us, you have full access to everything that we offer, including those seminars. Now, a question that I know a lot of people are asking was like, well, I'm getting started, how do I get more people there? How do I do that? My number one recommendation, I'm gonna have 2 recommendations. Number one is consistency. Your first seminar will be full of your friends and family and probably nobody else. So making sure that you're advertising at least 3 weeks in advance, honestly, utilizing social media events to promote them, but understand that not every single seminar is going to be a hit. I do recommend that you do them at least once a month and have them, scheduled, consistently. So like doing every Tuesday at 11 or every Saturday at 3, something that people are consistent and can count on. The last recommendation I get, especially if you're just starting out, is to use your networking partners and have co-branded events. So like I mentioned earlier, I had agents who have done co-branded events with personal trainers, real estate agents, but your most notable are going to be P&C agents, financial planners, lawyers, doctors. Have them do a 20-minute presentation on something, and then you do a 20-minute presentation on something like this. It attracts twice the audience and helps you build your relationship with that networking partner.
Yeah, I do. I love that idea. Kind of like what we're doing here today. We're bringing your topic and now we're showing you right into CSG how you can start marketing these different events, where you should be marketing them at. So
Absolutely.
Kind of good kind of intro into CSG here. I know we are having a lot of questions come in. We promise we will get to all of your questions. We just do want to be respectful of everybody's time here as well. So I'm going to share my screen here with you. I do have the CSG tool pulled up in here. So for those of you that are not familiar with CSG, CSG is a quoting and enrollment platform. Most of you do have access into CSG through your Integrity FMO. So they may have their own brand quoting tool. So the screen that I have here pulled up, you may be very familiar with these different buttons. The button colors may just look a little bit different. You also may have access through the Medicare Center. So the Medicare Center provides the CSG quoting platform right here on the homepage. So if you're used to signing into there, just click on this CSG Medicare app and it will take you right into something that looks like this. So CSG, we provide quoting for 100% of the market. So you're able to quote all your MedSup, Medicare Advantage, not only the companies that you're contracted with, but everybody in the market. So it really helps you understand the different carriers that are out there, especially on the Medicare Advantage side. A lot of your clients are going to start getting bombarded with advertisements, mailers, flyers, TV ads on all these different MA plans that are available. So our system allows you to go in and see what all of those plans offer in case your client does ask you about them, so you can do different plan comparisons. But we also do quoting for final expense, hospital indemnity, and senior dental and vision. So we really provide you an opportunity to quote multiple carriers, multiple products that really allow you to cross-sell efficiently. That's one thing that really stands out with CSG. And I always tell agents, CSG is way more than a quoting tool. Our main goal is to provide you with data to help you make the best informed decisions for your clients. So we're really going to break out for you not only a carrier's monthly premium, but what are their rate adjustment histories like? How is that client's premium going to increase as they age if they're on a MedSup plan? How many people are enrolled? How does that company's plan enrollment vary from year to year? But we also provide you some great market insights too on how many people in a certain area are over age 65, turning age 65. How many people are enrolled in a MedSup versus a Medicare Advantage plan? You can't get that data on any other quoting platform. So that's really where CSG stands out. So that's what I'm going to cover here for you today. And all of that can be found here in Market Edge. So all you have to do is when you sign into CSG, again, through Medicare Center or through your Integrity FMO's branded quoting tool, you can click on this Market Edge. And Market Edge, as I mentioned, it does 3 different things for you. It's going to summarize all of your Medicare demographic information. It summarizes all of the quoting tool as well. So out of the 8 million quotes that are around our system each year, we can really see how many agents are quoting a Plan G or a Plan N, or how many people are being quoted for a 65-year-old versus a 68-year-old. So it can summarize that quoting activity. And then you can also do some carrier heat maps on the MedSup. So today I'm just covering one of those features. We do have several different tutorial videos and trainings that we really dive deep into all the different features. I could train on CSG for an entire day, and I'm just going to show you what I want to here quick within 10 minutes here. So when you come into Market Edge, you can do multiple states, or you can select all states, or you can just select 1, 2, 3, however you may like to. You can just select those there. If you were interested in any of the quoting activity, so you wanted to know how many Plan G quotes were ran, how many Plan N quotes, and during that time frame, you can adjust that if you would like to. A lot of agents ask me, why do I want to know that information? And I always tell agents a couple of different things. One, it's important for you to know what other agents are quoting, just in case your current clients or your prospects are receiving marketing pieces from other agents, and maybe agents are putting a lower Plan N on a postcard, and you're putting a Plan G or a Plan F for that over age 65. So it's important to know what agents are quoting, and also for you to track those different trends. So we've been tracking these Medicare trends, and we can see, again, how many people are still quoting a Plan F for those individuals that are still eligible for a Plan F. Again, just important for you to know that data here. So I did do a national map just because I know we do have a lot of agents across the US on here. So it's going to take a second here to load. but I promise it will. And as this is loading here, question about those heat maps. So you can create carrier heat maps within here. You would just click on that go to rate comparison at the top. And what that allows you to do is select a particular carrier, so you can see how that carrier's premium is compared to all the other carriers in the market. So you can really see nationwide how many individuals, or I'm sorry, where that carrier is competitive at without having to run several different quotes. So that's what that heat mapping capability has for you. As this loads, I do have a couple of questions coming in from agents on the Medicare Center. So when you do click on that CSG app within the Medicare Center, if it says loading in the upper left-hand corner here, just make sure that you don't have any pop-up blockers that are blocking that. So disable those pop-up blockers or enable those pop-ups. That way it will go ahead and load here for you. It's still loading. Maybe I'm going to go and do, sorry that's taking a while. Of course, making me 1 second.
I will also vouch that we've been utilizing CSG. I remember when we made the switch, because prior to that, we were trying to do our own quotes and we were just not good at it. And carriers are changing and updating all the time, and we just couldn't keep up because we had our own jobs to worry about.
Exactly.
So I loved it whenever our agents, they will so lovingly refer to the CSG quote engine as the quoter. So I was on the quoter, and any single time we're like, yes, it does, run your quotes, but like, look what else this thing does, and they're just like, whoa, what do I call it now? It's not just a quoter anymore. So it is. I will just vouch for the impact that this will have on a day-to-day sales agent.
Oh yes, I always say it's more than just a quoting tool, more than just an enrollment platform. They can complete their scopes, they can store client drug information, they can create those carrier heat maps, they can do bulk quoting, quoting a bunch of leads at one time. So it's always far more than just a quoting tool here. So of course my national map took forever, so I'm just going to do a couple of states here, but these couple of states will give you a good indicator of what this tool can do. So it initially is going to map out for me and highlight a heat map, and it initially filtered by MedSup quotes ran. So as I hover over this particular tool, you can see how many MedSup versus Medicare Advantage quotes that we have within CSG. But what I want to focus here is that population over age 65, the population turning age 65, and the MedSup versus Medicare Advantage enrollment. So that's the key thing that we're going to focus in here on today. So let's say you're an agent in Texas. I'm going to use Texas as an example here. And you want to find pockets of Texas that have the most individuals turning age 65. We're going to go ahead and zoom into Texas here. So now it's going to break it out for me by a 3-digit zip code. Over here on my filter on the left-hand side, I'm going to go and change my demographics. So maybe I want to look at that population turning age 65, for example. Now it's going to heat map for me. These are the pockets with the most individuals turning 65. Well, maybe although like the Dallas, Fort Worth, Houston area has the most individuals, you're not really located in there. You want to just focus in on your own area so you know what parts of your neighborhood that you should be going into, where you should be putting out those flyers, or which doctor offices you should go be visiting to have them join you on some of these dental offices. Olivia, I think you mentioned like gyms as well. So really using this to figure out where those pockets are, and then that's where you need to go visit, right? So let's just say, let's just look at the Houston area. I'm going to zoom in here. And now we're into a 5-digit zip code. So as I hover over these different pockets here, you can now see how those numbers adjust. So I know in this 5-digit zip code, how many people are over age 65, how many people are turning age 65, and how many people are enrolled in a MedSup versus a Medicare Advantage. So use this information to tailor those seminars that you do. One question that we had that came in, Olivia, and I'll kind of have you answer it too, is how do you keep those individuals that are over age 65 that are still working because they're delaying their retirement. How do you kind of keep those individuals engaged in some of these seminar topics that you cover? So maybe how you're covering those is different, and maybe you're not targeting the population turning age 65, you're targeting that population over age 65. So you can really see here how those numbers change. Olivia, what are your thoughts on the people that are still working past age 65? So they're still on their group or their employer plan, maybe they're on the spouse plan, and they're delaying their Medicare for a couple of years. How do you keep those individuals engaged?
Those are some of the best consumers, because when they realize that, like, hey, I can't help you, I'm not going to make money off of this conversation, but I still want to make sure that you're educated and I can still help you. That's some of the best services you can provide somebody, and then you get the most referrals for those individuals because you come across really authentic and good at your job. As far as keeping a lot of those people engaged, what I always recommend doing is, if you have some sort of newsletter or communications, your social media, getting them to subscribe to your newsletter or getting them to be a part of your social media so that you stay top of mind. If they don't utilize your services, and they're not going to, if they have other coverages available, it's really easy for them to forget about you. So whenever they do have questions, because they will, you want to make sure you maintain keeping, top of mind. So making sure, again, subscribing to your newsletters, following you on social media would be a huge proponent of that. Another thing I'll recommend is going to be another networking tip. People who have a lot of success are actually individuals who network and partner with HR people. Find out who was handling the insurance questions at local businesses, both large and small, because when somebody does decide to retire, the first person they go to is the person who's been helping them with their insurance for the past X amount of years. Unfortunately, that HR person knows little to nothing about Medicare. They only know how they operate in their field. So we do offer a really cool kind of a booklet that agents can have personalized, and it's basically an HR guides to Medicare. So you partner with, these local organizations, these businesses, give them this book and say, everything, Mr. and Mrs. HR lady, anything that you need to know about Medicare is in this pamphlet. If somebody asks you a question and you can't find the answer in this pamphlet, my number is on the bottom of it. Call me. So that it really does get your foot in the door. You are the expert that other experts refer. Also doing seminars with them and saying, let me do a seminar for people who are Medicare eligible, even if they're still working. Funny thing is that the average caregiver is a woman between the ages of 40 and 45. And so they're taking care of Medicare eligibles. So they'll come to those seminars as well, especially if you're doing it for that HR representative, and you'll get a couple more clients just because they're the decision maker. That's a long answer to a short question.
No, I love it. And I think, again, an important piece of this demographic information is for you to also look at that MedSup versus Medicare Advantage enrollment. So we're also tracking those trends. So if your topic is centered around Medicare Advantage, you want to find pockets where there's more Medicare Advantage or a higher number than a MedSup. So making sure that you're marketing your events in areas that make the most sense to those topics that you are covering. So remember, you can come over here and you can filter that. So maybe you're in this Ohio, north of Columbus type area, and your focus is more, you're more of a Medicare Advantage agent. You kind of go more that direction. So again, using this to find those pockets where it's going to be the best return of your investment on hosting these events. So we do get our data from CMS, but also census information as well. So these numbers on our system do update each month. A lot of questions I get when I present this to agents is that, can I go in advance? So can I do 6 months turning 65? Our system is just showing data for this month. I will tell you, after looking at these data points for the last 4 years, that population turning 65 does not vary so much month to month. So in 3 months, you're probably going to have around the same number of turning 65. We just don't see a huge spike in birthdays in a certain month, but maybe over the course of 8 months, 10 months, we may see a bigger shift. But from month to month, you're not going to see too much different there, because I know Olivia did mention, you know, marketing these at least 3 weeks in advance to these individuals. All right, and I will tell you, I have some questions that are coming in. The reason why you're seeing more med sup quotes ran on our system is a lot of agents do use us for med sup quoting. We are pretty dominant in the med sup quoting field. Also, right now is not a huge time for agents to be quoting Medicare Advantage. We'll see a huge spike come October 1st in Medicare Advantage quoting. A lot of agents still may use Medicare.gov or some of the other tools within Medicare Center for their Medicare Advantage quoting. CSG is just very dominant in the med sup space because we are the only quoting system that allows you to quote 100% of the med sup market. You won't find that anywhere else in this industry. So a lot of agents turn to us for that data. And also, we're the only company or the only quoting that offers all of these different analytics. So for you to be able to track readjustment history, market analytics, for you to do a kind of a cross-sell with a dental. So that's really where kind of CSG stands out. So you can run national maps too. And as Olivia mentioned, so she said she was in like the Lake of the Ozarks area. You can come into this system too and may find those pockets, which are on the national map too, on certain areas that may be more of a vacation spot too, for individuals, or a second home as we call it too, on these maps. And then you can kind of hover over and see, okay, how many people are turning 65 in the Lake of the Ozark area, or how many people are over age 65 down in Florida. So again, using this to better educate yourself too on where those demographics lie. All right, well, we are coming up on time here. I always like to be super respectful, and for you all to be on this webinar for the last 50 minutes, I always appreciate it. I know the time that you spend with me and whoever else I have on these webinars means that you're not writing an application. So again, I always appreciate your time. I really hope that you guys got a lot of information out of this. All of those webinar topic ideas that Olivia covered and presentations, they are all available on the SMS website. So let me pull your presentation up again. Let me just pull that up so you guys can get that website link here, smsteam.net. That's if they sign in correct. And if they don't have a login to your website, they can contact you, Olivia, yes, about getting access.
Yes, absolutely. There's a register button there as well. So it's pretty intuitive is the word that I would use. But if you do have active contract with us, go ahead and log in. It's under services and sales tools. So there we have a lot on our website, but particularly today, go there, check out. Again, not all of our presentations are on there currently, because even though they technically do not need to be looked at by CMS, or because they don't need to be registered, we still want to make sure that we're doing everything we can to give you guys compliant information. So some of them are on there, not all of them.
Yep, and then if you want to learn more about CSG and the different features that we offer, if you go to our website, csgactuarial.com, underneath Learning Center, we do have some shorter little tutorial videos that are all posted here. If you go down to the CSG app Medicare Center, we do weekly webinars with agents that have access into Medicare Center through their Integrity upline. So we do different webinars for you all. So you can attend any of these webinars. If you are new to CSG, I do have a webinar next week on a new to CSG training that is great. It's just a good overview of everything we offer. We also offer you the ability to complete your applications on our system. We are launching our Medicare Advantage and Part D e-apps as well. So you'll be able to submit Medicare Advantage applications on our system this AEP. We have several different training opportunities for you to watch how you can do that. We have some webinars. A lot of you, if you are more Medicare Advantage focused and you want to learn how to cross-sell with hospital indemnity, we have a tool for that. It's the only tool in the industry. It's called our Fill the Gaps tool, which allows you to stack a Medicare Advantage alongside a hospital indemnity. And one of those 10 topic ideas was the cancer, and some of those Medicare Advantage, those hospital indemnity plans may have a cancer rider, so you can review all of those different options for your clients on the Medicare Advantage plan. So lots of great training opportunities too here. And then if you click down on watch previous trainings, this is where we host all of our webinars too on all the different topics. So you can always watch those on demand when your schedule fits. So I appreciate everyone's time. Olivia, I appreciate your time as well. I know it's valuable as well. So thank you, everybody. I'm going to launch a survey here as I close up. And then if you wouldn't mind just answering those 2 survey questions, I greatly appreciate it. Olivia, any last words?
No, again, I just really appreciate the opportunity. I know, guys, we are ramping up for our crazy busy time. And so just good luck to everybody this AEP. Please reach out to your partners, find out who's in your corner and rely on them. That's what Senior Marketing Specialist does, is being in your corner. So thank you guys for the opportunity. Love anytime I get to talk about Medicare, because no one else wants to talk about Medicare with me. So thank you.
All right, everyone, have a great rest of your day. Olivia, we will see you very soon.
Sounds good. Thanks again.
Bye.